age-related macular degeneration or AMD. The eye is our organ of sight. The eye has a number of components which include but are not limited to the cornea, iris, pupil, lens, retina, macula, optic nerve, choroid, and vitreous. Let us discuss further on main component of eye. Cornea is a clear front window of the eye that transmits and focuses light into the eye. Iris is a colored part of the eye that helps regulate the amount of light that enters. Pupil is dark aperture in the iris that determines how much light is let into the eye. Lens is a transparent structure inside the eye that focuses light rays onto the retina. Retina is a nerve layer that lines the back of the eye, senses light, and creates electrical impulses that travel through the optic nerve to the brain. Macula is a small central area in the retina that contains special light-sensitive cells and allows us to see fine details clearly. Optic nerve connects the eye to the brain and carries the electrical impulses formed by the retina to the visual cortex of the brain. Vitreous is clear, jelly-like substance that fills the middle of the eye. Age-related macular degeneration or AMD is the main cause of legal blindness in the elderly. It is a complex and progressive macular disease due to multiple genetic and environment factors. Disease progression and development leads to severe vision loss. Causes of age-related macular degeneration: being 60 and older in age, chronic smoker, genetic, high blood pressure, heart disease, obesity, high cholesterol, low intake of antioxidant in diet. There are two types of age-related macular degeneration, that is, dry AMD and wet AMD. Most AMD starts as the dry type, and in 10 to 20% of individuals, it progresses to the wet type. Age-related macular degeneration is always bilateral, that is, occurs in both eyes, but does not necessarily progress at the same pace in both eyes. Retina is the lining of the eye which responds to light. Here, cross-section of retina can be seen. In dry form of AMD, metabolic end products collect underneath the retina. These deposits are called drusen. Dry AMD causes gradual central vision loss and differs from patient to patient. In wet AMD, blood vessels that are leaky and abnormal begin to grow into retina. Unlike normal blood vessels, in rest of the body, those seen in wet AMD cause swelling and bleeding into the retina. Wet AMD leads to gradual loss of central vision as this vessel leak fluid or bleed. If untreated, vision loss can progress. Symptoms of age-related macular degeneration include blurred vision, faded vision, wavy vision, loss of central vision. Discuss about diagnosis of age-related macular degeneration. Amsler grid. If you have macular degeneration, you can check yourself on Amsler grid. Optical coherence tomography (OCT) is a diagnostic technique that gives clear image of retina with high-resolution pictures. Fundus fluorescent angiography (FFA) is a common procedure that is performed to give more information about the condition of back of the eye. Treatment options for age-related macular degeneration. There is no single proven treatment option for dry form of macular degeneration. However, antioxidant, vitamins, and zinc reduce the impact of macular degeneration. In case of wet AMD, treatment options are anti-VEGF injection therapy, photodynamic therapy, and laser treatment. Currently, the most common and effective treatment options for wet AMD is anti-VEGF injection therapy. Photodynamic therapy involves light-sensitive medication and a light source to destroy abnormal blood vessel in macula. Laser treatment utilizes laser light to seal new blood vessels from leakage in macular region. Let's understand how anti-VEGF injection therapy works. Anti-VEGF injection therapy stands for antivascular endothelial growth factor. These drugs work by stopping a protein called vascular endothelial growth factor or VEGF produced by cells in the retina from working. VEGF promotes blood vessel growth in the body. The intravitreal injection is injected into vitreous cavity. On injecting, the anti-VEGF binds to VEGF and stops leakage from blood vessel and improves visual quality like color brightness and sharpness. It also improves day-to-day activities such as reading, watching, driving. It is approved medication for wet age-related macular degeneration. The effect of drug lasts for a month or maybe more. Hence, the number of injections received will depend on your eye condition and as per your doctor's advice. Lifestyle changes to prevent age-related macular degeneration includes avoid smoking, regular eye checkup, eat nutritious food, and avoid junk foods, exercise regularly, keep your blood pressure under control, avoid drinking alcohol.